everyone, and thank you for joining us today as we gather to talk about the important issue of childhood immunizations. I am Dr. Rachel Christensen, and I'm with the Michigan Osteopathic Association, the Michigan State University College of Osteopathic Pediatricians, and Sparrow Hospital. On behalf of the Michigan Osteopathic Association and the Michigan Coalition of Physicians and Nurses, I thank you for coming today as we come to try and urge Michigan parents to update their childhood immunization schedules so that their children are ready to learn for a complete and successful school year. The Center for Disease Control and Prevention reports that Michigan has the 4th highest non-medical exemption rate for vaccines in the nation. And that means that more than 5.3% of Michigan parents simply choose not to immunize their children. That means that every year, thousands of children, Michigan children, become ill with vaccine-preventable diseases. With the immunization rates dropping in Michigan, that means that more children may be becoming ill. Children are a little more vulnerable than others because of their developing immune system, their attendance at schools and at daycares. That's why Michigan law requires immunizations be done prior to the start of school. Immunizations are safe and effective. If parents have any questions about their safety, effectiveness, side effects, we urge them to talk with their healthcare providers about those. Again, in our effort to better educate parents about the importance of childhood immunizations, we all come together to do that. The Michigan Association Coalition of Physicians and Nurses, the Michigan Osteopathic Association, the Michigan Academy of Family Physicians, the Michigan State Medical Society, the Michigan chapter of the American Academy of Pediatrics, the Michigan Association of School Nurses, the Michigan Council for Maternal and Child Health, and the School Community Health Alliance of Michigan. So standing alongside the coalition is someone very passionate about family and child issues. I have the great pleasure of introducing the First Lady of Michigan, Mrs. Sue Schneider.
Thank you for that great introduction, Dr. Christensen. It's an honor to stand with so many dedicated health professionals this afternoon. It's also great joining you here today to support smart health choices for our state's children. With the fall season approaching and school getting back in full swing, it's a busy time of year. New shoes are tied, pencils are sharpened, and healthy lunches are packed. Parents and caregivers are doing what they can to ensure that their little ones step off on the right foot. And vaccines are an important and sometimes overlooked part of the children's back-to-school success. Successful learning begins with healthy kids in healthy environments. Young children are especially vulnerable to germs and diseases because their immune systems are still developing. Combine developing immune systems with daycares and classrooms, and it creates a close-knit setting where germs can easily spread. We can help prevent the spread of many diseases with the appropriate vaccinations. As a mother myself, I know firsthand how difficult it is to see when your children aren't feeling well. There's nothing you won't do to ensure that they get better as quickly as possible. And it's hard to think of the thousands of Michigan children each year who miss school and fight diseases that could have been prevented with required vaccines. My 3 children are now grown and on their own. My son and oldest daughter are in their 20s, and our youngest is just starting college. Although they're adults now, the mother in me still worries about their health, and I encourage them every year to get their flu vaccines. We're lucky to live in a time where many diseases are no longer a concern, but we can't take that for granted. Dangerous diseases still exist. Even those as common as the flu and chickenpox can have life-threatening effects. Childhood immunizations protect our children from measles, mumps, whooping cough, and more. Studies show that today's vaccines are safe, reliable, and necessary to further put a stop to preventable disease. I encourage all parents to contact their family physicians for more information and get their children the vaccines they need and protect their health. Children are truly our future. Good health and strong immune systems can help set the foundation for a happy, healthy, and fulfilling life. With good health, Michigan's children can be more focused in the classroom and grow into healthy and successful adults. Ensuring kids get the vaccines they need is one of the easiest, safest, and most important things we can do to support them. Through needed vaccines, we can create a better, healthier state for kids and adults alike to live, work, and play. And now I turn it over to the experts who can cover the medical and technical side of this critical issue. Thank you.
Next, Dr. Rockwell, on behalf of the Michigan Association of Family Practitioners, will speak about some of the vaccine preventable diseases.
Thank you. Hello, I'm Pamela Rockwell, longtime member of the MAFP, Michigan Academy of Family Physicians, AAFP. I am a DO. I work for the University of Michigan. I'm assistant clinical professor there, where I'm also medical director of Dominus Farms Family Medicine. Okay, so I teach medical students and residents, and I am a huge vaccine proponent. I completed a fellowship in vaccine science. So I'm here to talk about a couple of diseases just to let folks know these are serious diseases, what those clinical signs and symptoms are, and what devastating effects they can have. So what's in the news these days is whooping cough, or pertussis, as you may have heard. It's caused by bacteria called Vortella pertussis, and because it's a bacteria, we do have an antibiotic that can help treat it. However, if the antibiotic isn't started soon enough, it is not quite effective, and little children are not immunized against pertussis until they are older. So it is those infants, those newborns, who are most at risk for this disease. The bacteria is highly contagious, and older folks can actually have whooping cough or pertussis and not even know it, and pass it along to little newborns in the community. Signs and symptoms of pertussis usually start pretty mild, like a cold with runny nose, congestion, and a cough that's not really terrible. Over days and then weeks, the cough develops into the classic whooping cough, where there are fits of uncontrolled coughing to the point where the patient is out of breath, and as they inhale to try to get some oxygen, they actually create a high-pitched whoop, and that's where whooping cough is known. The name is known from. So in China, this was deemed the 100-day cough because it can last so long. So complications with pertussis usually occur in little children. About a quarter will get pneumonia. 1 or 2 out of 100 with pertussis will have brain effects and convulsions or seizures. 2/3 will have apneic episodes. And what that means is they actually stop breathing for a couple of seconds at a time. 1 in 300 children will have encephalopathy, that is inflammation of the brain, which is quite serious. And 1 or 2 out of 100 children with pertussis will die. So again, the treatment is antibiotics if caught early, but the major goal is prevention through immunizations. As a matter of fact, the CDC has now changed its recommendations for pregnant women this year. All pregnant women are advised to get immunized with the Tdap, or the P is pertussis, and that's the P in the Tdap. That vaccine in the 3rd trimester of pregnancy, and this will ensure that they will make antibodies and they will flow to the baby through the bloodstream. So when the baby is born, the baby will actually be born with some antibodies against pertussis. So the second disease I want to talk about is also becoming more frequently mentioned in the media, and that's measles. Measles, unlike pertussis, is caused by a virus. We have no treatment for this virus. We can only support the patients who come down with measles. The serious illness for measles occurs in children, like pertussis, but it's a little bit wider age group. So it's children age 5 and under, And then young adults age 20 and above are most affected by measles. In the year 2000, the United States declared that measles was eradicated. That means that measles was felt to be completely abolished from the United States. To get that distinction, there has to be 12 consecutive months of absolutely no measles cases being diagnosed in the United States, and that happened. This year, 2014, the statistics from the CDC, or Center for Disease Control, show that from January 1st through August 29, there have been 592 cases of measles documented in the U.S. And that's probably a low number compared to the folks that weren't ever diagnosed properly. This virus is one of the most contagious viruses known to man. If one person has measles in the room, 9 out of 10 people in that room will get the measles infection if they don't have immunity. So this can be from breathing the same air because somebody coughed or sneezed. The virus can live for about 2 hours on this podium. If I were to cough and have measles, somebody else can come by, touch that, and then all they have to do is touch their nose, their mouth, or their eyes, and then the virus is entered into their own bloodstream. So the symptoms of measles usually begin about 7 to 14 days after the person's infected, yet they can spread the disease within that time frame. So the fever associated with measles is usually quite high, in the 104 to 105 range. Classically, there's red, watery eyes, there's white spots in the inside of the mouth called Koplik spots, and then the classic rash starts several days after the fever, and that's a reddish-brown rash that starts at the hairline of the face, works its way down the body. Unlike other rashes that might start in the middle and work their way out, this one's pretty distinctive from the face on down. The complications usually are pneumonia, ear infections, and diarrhea, but the serious things that can cause death would be encephalitis and permanent brain damage, permanent hearing loss. 1 out of 1,000 cases of children with measles will develop encephalitis. For every 1,000 children who get measles, 1 or 2 will die from respiratory or neurologic complications. And anybody who's immunocompromised, including pregnant women, will also suffer more. Pregnancy may result in an unfortunate miscarriage, low birth weight baby, and again, there's no specific treatment. So the best defense against this is vaccination, so I highly encourage you to all get your children vaccinated. Thank you.
All right, next we're going to hear from Patricia Bednarz with the Michigan Association of School Nurses with some of the impact that immunizations has on our school community.
Good afternoon. I am Patricia Bednarz. I work right here in Lansing. I've been a school nurse for almost 26 years at the Lansing School District. The National Association of School Nurses and the Michigan Association of School Nurses support the Center of Disease Control's recommended vaccine schedule, as well as federal, state, and local legislation that provides for the immunization of students and their families. In Michigan, school nurses are deeply concerned about the vaccine rates for our children. In 2011, only 72% of our 2-year-old children were up to date on their recommended vaccines, and only 63% of adolescents were up to date on their recommended vaccines. This can lead to dangerous outbreaks of preventable diseases. We know that thousands of children become ill because they have not been immunized. We urge parents to make sure that their children are up to date on his or her immunizations. When parents immunize their school-aged children, they're protecting their younger children at home. When parents don't immunize their children, they're putting their children at risk as well as other school children in the community at risk for these diseases. Today's vaccines are very safe and reliable when it comes to preventing diseases. School nurses can help link families to immunization facilities, and we can also answer parent questions. Finally, school nurses want to remind parents that flu season is approaching, and all children 6 months of age and older should receive their annual flu shot. Thank you.
All right, lastly, we're going to hear from Dr. Mary Mora, a practicing pediatrician in the Lansing area.
Thank you. Good afternoon. As Rachel said, I'm Dr. Mary Mora. I practice here in Lansing in private practice, capillary pediatrics. I am privileged to be here today on behalf of the Michigan State Medical Society and also the Michigan chapter of the American Academy of Pediatrics. I would like to share with you the impact that immunizations has had on my practice over the years. I also want to thank First Lady Sue Snyder for her words and for taking the time to be with us today. Having the First Lady of Michigan here shows that she understands the importance of immunizations for the health of the children of our state. I have been a pediatrician for over 30 years. In that time, I've seen many advancements in medicine. Of these advancements, the development of new vaccines to prevent devastating childhood illness has had the biggest impact on the health of children. I am thankful to the scientists whose hard work has made this possible. I'm also thankful to the public health system and the government in our state and in our country for the efforts they have to ensure vaccines are used effectively and that vaccines are available to everyone. Mandating immunizations for daycare and school participation has made a major impact on the ability of providers to get children vaccinated. When I first started practicing in the early 80s, there were 7 diseases that children were routinely immunized against. Our routine vaccine schedule today includes vaccines for 16 different infectious diseases. We now have vaccines against 3 organisms that were the most common causes of bacterial meningitis when I trained. Meningitis is a disease that causes swelling around the brain and is often lethal, even with quick and aggressive medical care. As a parent and as a physician, I am very thankful for these vaccines. In the 1990s, a vaccine was licensed for chickenpox, a disease that most adults think of as a benign childhood illness. Chickenpox is not always benign. Complications from chickenpox can be fatal, and for one family in my practice, whose healthy 10-year-old died as a complication of chickenpox, the vaccine came too late. About 10 years ago, a vaccine for the treatment of rotavirus was licensed. This virus causes vomiting and diarrhea so severe that many young children with this infection needed to be hospitalized for treatment of dehydration. The first year the vaccine was used routinely, there was a decrease in hospitalization for dehydration in children under 40 years of age by 90%. I don't even remember the last time a patient of mine had to be hospitalized for treatment for dehydration from this infection. In 2010, the CDC recommended universal influenza vaccine for every person 6 months and older. This has had a major effect on the annual winter influenza epidemics in our country. Last year, I did not diagnose any cases of influenza in my office, and of the patients who I care for in my practice, only a handful were diagnosed in any healthcare setting. This is quite a difference from the 5 to 10 people I would diagnose with influenza daily at the peak of an influenza epidemic in years past. As children head back to school, our office is gearing up to be able to get as many of our patients immunized against influenza as possible this fall. We'll be also taking this opportunity to be sure that our patients are up to date on all the recommended childhood immunizations. Immunization programs in our country over the past 60 years have been very successful. Illnesses that used to be common, childhood illnesses, are no longer common. Most parents of my patients have not seen these diseases. They have not heard the whoop from a child with pertussis and have not had to comfort a friend whose child was diagnosed with meningitis. They have not had to worry that their child would get a fever one summer day and be crippled for life from a virus called polio. When a parent told me that they did not want to have their child immunized, but wanted to go natural, it was impossible for me to understand. The natural consequences of these diseases are devastating, and nothing that any parent would ever want for their child. Today's vaccines are very safe and reliable and far better than the alternative. We need to have better immunization rates to help protect everyone from these easily preventable diseases. Today we are here to make a commitment to the health of the children in our state by supporting immunization efforts in Michigan. Immunizations are safe and effective. If parents have any questions about their child's immunization, they should speak to their primary care physician. By working together as a team, parents, physicians, scientists, school staff, public health officials, we can create a safer and healthier environment for our children. Thank you.
That concludes our talks for now. I want to thank again the First Lady, Mrs. Sue Snyder, for coming and putting forth this most important topic for our children of Michigan. I'll open it up, yes,
Oh, it's a question.
to questions.
Isn't the real answer here not so much education, but to eliminate the non-medical exemptions that are creating these pockets of outbreaks of diseases that are easily prevented?
Well, the non-medical exemptions need to be discussed in a face-to-face. If we can get parents to come in and talk to their primary care physician, I think communication is one of those things that they can tell us why they're hesitant to immunize, and we can tell them about the safety and effectiveness, and that relies again on that patient and family doctor relationship.
But if we didn't allow the exemptions, I mean, you can't cure stupid. I mean, these people are putting their children at risk for really stupid reasons. I mean, should we allow non-medical exemptions outside of personal religious exemptions, as it?
Right. I think that's a topic that's being discussed in other venues right now. Any other questions? Yes.
You mentioned several times that people should talk with their family physicians if they do have questions. Where are they getting this misinformation if it's not from the medical community that they know and trust?
Most of that misinformation comes from computers, internet, other family members, friends, who might have misunderstood or thought that their child had a reaction or a consequence. Unfortunately, as we give immunizations, we give those early in life to prevent those illnesses, and that's when a child is developing. And some of these other diagnoses that come, we can't diagnose other problems earlier than that. And so it's more of a coincidence, but they might think that they're related. Does anybody else have any?
Okay, thank you very much.
Other questions?